Excellent. We're all good to go, Emily. Let's kick things off, shall we?
Sounds great. Thanks, Jerome.
Pleasure. Welcome everyone to today's webinar, which is looking at National Road Safety Partnership Program webinar, Health in Gear, Turning Truck Drivers' Health Around where they work. This webinar is a result of OzHelp winning the 2022 Australasian Road Safety Conference Award for Best Paper with Implications for Road Safety. So very excited to go through and hear all about the amazing thing that you've been doing with truck drivers out there, Emily. For those of you who don't know, my name is Jerome Carslake. I'm Director of the NRSPP and its many activities. To find out more, please visit the NRSPP website, register for our newsletter, and you can touch base with us on social media as well and support the many things that we are doing. Today's session is going to go for around 60 minutes and it's going to be nice and interactive. Emily's informed me that she's very keen to take questions as we go through, but just to be sure of things, we've also got a couple of hold points to make it as interactive as possible. So as I touched on, we want to make this webinar as interactive as possible. So there is a question box coming up. You can just tap in there, throw things in the question. The chat is live and open, and so we're all good to go. So now next to our amazing presenter, Emily, welcome.
Thank you, Jerome. Thanks for having me. Great to be here.
So some of the amazing things about Emily, we had to compress her bio down. If you want to see more, jump onto the website. So Emily is an innovative leader with over a decade of experience working in acute mental health and hard to engage population groups, including young people in out-of-home care, forensic medical health, and working with veterans. And truck drivers are certainly one that falls into that gamut. In Emily's 18 months of being with OzHelp, she's been instrumental in establishing a robust clinical governance system and implementing lived experience partnerships within the organisation. So spectacular. Let's dive on in.
Thanks so much, Jerome. So hi, everyone. It's a pleasure to be here today to talk to you all. So yes, I work at the OzHelp Foundation. I'm the clinical director here. I'm really grateful to have this opportunity to speak to you today about our program Health in Gear, which is all about improving the health and wellbeing for those working in the transport industry. I'd like to begin by acknowledging the traditional custodians of the land in which we meet today. For me, that's the Ngunnawal people, and pay my respects to their elders past, present and emerging. And I extend that respect to anyone joining us, Aboriginal and Torres Strait Islander joining us today. I'd also like to acknowledge the lived experience of anyone joining us today. So for those who have or are doing it tough, as well as their families and carers, it's okay not to be okay. You're not alone. We acknowledge the strength and courage it takes to reach out for support and the barriers you may have faced along the way. Every story is important, every struggle is valid, and there is hope. You've proven it by being here. So just to talk a little bit about OzHelp and who we are, we're a leading national not-for-profit provider of mental health and wellbeing programs. So we focus on providing services to hard-to-reach people in industries with a heightened risk of suicide. So we have a specific focus on building construction and also transport and logistics. Here at OzHelp, we offer a range of evidence-based health and wellbeing programs, which is designed to assist individuals to build an awareness of risk and protective factors for mental health and suicide. Oh, sorry, my slides have just, sorry, 1 second. I hope that didn't jump for people. Implement strategies to improve health and wellbeing, how to recognise the signs of distress in others, offer support, and also connect them to help. At OzHelp, we provide early intervention health and wellbeing screening, and we also have access to free wellbeing support and counselling services. I think one of the key things that differentiate us from other services who are in this space is that we have an outreach component to what we do. So we go out to building construction sites, out to the truck drivers, and I think that's really one of the key differences of the support that we provide. So what is Health in Gear? We know that truck driving is one of the most challenging jobs in the country. with heavy vehicle drivers, they carry a high burden of chronic disease, injury and poor mental health in comparison to other occupation groups. And additionally, truck drivers represent the second highest occupational group after construction workers at risk of suicide. So at OzHelp, we wanted to develop a health and wellbeing program that would assist the transport industry. So this program, we developed it in collaboration with truck drivers and the transport community. So we went through what's called a co-design process to ensure we were creating a program that would actually meet the unique challenges that this industry faces. We really wanted to develop something which supported the health and wellbeing of transport and logistic workers and their families. And also just to let you guys know that Health in Gear is funded partially through the National Heavy Vehicle Regulator's Heavy Vehicle Safety Initiative, and also supported by federal government with contributions from OzHelp and industry partners. So in 2021, we launched the pilot phase of this program, and I'll share more with you in some later slides about how that went. So what is the Health in Gear program? What is it made up of? I'll just go through a little bit in detail about the different components of the program. So we know traditionally that this cohort is hard to reach. However, we know that early intervention works, and that early intervention can affect changes in attitude, knowledge and behaviour. Our priority was to take this program on the road to key transport nodes to reach as many drivers as possible. So the Health in Gear program takes into account the challenges faced by Australian drivers and focuses on simple but effective actions designed with drivers to improve their overall wellness. So by engaging with us through the Health in Gear program, drivers can learn simple skills, connect with support and improve the overall wellness. So components of the program, as you can see there, is a roadside health check. So we park at either distribution centres or key hubs along major transport routes, and we offer free mobile health screening, which is accessible to drivers while they're on the job and out on the road. It takes 10 to 15 minutes. Support and counselling. So we have free support and counselling from trained professionals that's offered to drivers for a period of 1 year. And we also have a dedicated 24/7 phone support line. So that's industry tailored, and it supports the needs of both transport and logistic workers and their families. On our website, you'll also find a range of health tips, and these focus on key health and wellbeing areas, which are again broken down into small achievable actions. And we also have a very cool podcast called Share the Load. And this is another way that truck drivers can just get to know us a little bit more, listen to it while they're on the road. And it's all about promoting mental health and wellbeing, and with truck drivers sharing their own stories about challenges they might have faced and how they might have overcome that. So just in relation to the roadside health checks, as I said before, they take around 10 to 15 minutes. We know that truck drivers are time poor, they work long hours. And I don't know about you, Jerome, but I've never seen parking for a B double or a road train at a local GP. So we really wanted to make it as accessible as possible for truck drivers. And we have a nurse and wellbeing support worker who complete the health checks. And the process of what you go through is we ask a series of questions about your general health, general physical wellbeing. We then take height, weight and waist measurements. We check blood pressure and cholesterol, and that's really to check some common kind of chronic conditions that truck drivers often face in terms of chronic disease. We then work with the truck driver to create an action plan, and that's all about small achievable goals that are sustainable, that work on helping improve their overall health. And then,
what are the examples of that, Emily? What would be some of those little goals they might strive for?
Yeah, look, I think we all know that, as I said before, that truck drivers are really time poor. And the feedback that we hear is that they say, well, I don't have time to join the gym, or I don't have time to, invest in this stuff. So it's all about small things that they can do while they're on the road. So for example, when they park their truck, if they're going for having a break, is before they go in to the service centre, it's around, can they do, 2 power laps around their truck, which is kind of building up that incidental exercise. Another example might be, we know that, it's really important for people to stay awake on the road. However, that can mean increased amounts of caffeine, which also has some impacts for their health and well-being, depending on how much is being consumed. So it could just be as simple as reducing that caffeine intake just by 1 cup of coffee, and the kind of impacts that can have. So we're talking about very small changes, but it's about what drivers identify as things that are potentially problematic for them.
Okay, that's great. And actually on that, I remember there was a truck driver I was talking to. One of the habits he does when he pulls up, goes for his walk during his break, and actually picks up rubbish as he's going on, has a little pickup thing, and put that into it. So has that, and he said really enjoys it because he focuses on that, has total downtime, but also with total walking at the same time. Yeah.
There are, sometimes it can kind of seem that it's too hard to do, but we have kind of a range of, ideas and strategies that we can chat about in terms of something that's going to be workable for them. It's all about what's actually going to fit into your schedule and your life, rather than us saying, oh, you've got to do 60 minutes of exercise a day.
Fantastic.
So after the health check too, what we do is offer follow-ups and regular check-ins at time intervals. So they occur 3 weeks, 3 months, and then 6 months after the initial health check. And that's all about checking in with the participants about what's going well with that action plan. Have you been able to do it? What's not going so well? Is there any kind of additional support that you might need? And feedback from the truck drivers to date is they really like those check-in points, because it kind of keeps them accountable to that action plan. So like, health and gear guys are calling us today, we better do something about that action plan. And yeah, we've had some amazing conversations with people through those phone check-ins. So just in relation to that pilot phase, I said I was going to have a bit of a chat about that. So when we commenced that in 2021, we initially delivered that across ACT, New South Wales and Queensland, and we completed 78 health checks in that initial phase. And after that pilot project, some of the key kind of things that came out of that is that we had a really high level of engagement with drivers, and lots of people with, really great intentions to follow up with their healthcare providers too. So they were following up with those actions and implementing some changes, which was really great. So after the success of the pilot in 2021, we focused on making some amendments to the program based on feedback that we'd received. And then in February last year, we launched what we call phase 2 of Health in Gear, which is really aimed to build on the success of the pilot. So last year was really all about expanding program delivery. We wanted to reach as many workers in the transport industry as possible, noting the success of the pilot project and the initial great feedback that we were receiving. So that expansion included additional roadside hubs, and we also commenced working with our new corporate partners to deliver Health in Gear within their distribution centres. So as you can see there, those stats that are included. So from February to September last year, We amazingly delivered over 900 health checks at 40 locations across Australia, which is quite a jump from our initial pilot project where we did 70-something health checks.
Incredible effort by your own organisation, like getting out and about, and because it's not just a small task to go and just, Australia's so big, drivers are all over the place. So hats off to your own people as well.
Absolutely. What people might not know about OzHelp Foundation is that we're not actually very big. We're a not-for-profit provider. And so the logistics of us travelling all around Australia with a small team, is kind of no small feat. And being able to do that means that, we have a really dedicated team who absolutely love what they do. They're out on the road. They can see the impact that they're having with this program. And so we've got an amazing dedicated team working to roll out this program, which is, it's really great. So just quickly about our corporate partners, I'd just like to mention them. We've got a quote here from Coca-Cola Euro Pacific. So the reason why we partnered with some larger corporations was because we wanted to really move that expansion and have this program available to as many workers in the transport industry, inclusive of logistics, warehouse and manufacturing, because we know that workers in those areas also face many of the same issues that truck drivers face. So as you can see there, Lisa from the head of health at Coca-Cola Euro Pacific provided a quote there in relation to why they've partnered with us and the impact that it's having on their cohort. And another one of our corporate partners, shout out to Coles. So David Clark, Head of Transport and Sustainability, has also provided the following quote for us. And so partnering with Coles and Coke has really given us that opportunity to embed the program across the transport industry, because we know drivers' health not only affects the individual, it has a really big impact on the family and also community wider than that. There is a direct link between road safety and chronic diseases, injuries, ill health, and fatigue. So expanding our reach through our corporate partners, we're working to support families and the wider transport community, and ultimately working towards making our roads safer. And just to give you a bit of a sense, Aussie's a pretty big place. We've flagged the key locations here on this map that we visited last year. So I think we managed to calculate that we'd travelled some 50,000 kilometres across the country to provide the support. Little old Tassie there's not forgotten. We definitely went to Tassie. So every state and territory across Australia.
Just looking at this, Emily, Kim Hassel just put a bit of a comment in the chat, and I think it's a really powerful one, and it draws on as well what I heard yesterday in a Comcare session. So Kim was just saying here, some 15 years ago, a major association delivered a driver health program. What they found out that the implementation got a great boost by making the wife partners of the driver aware of the program. And yesterday I was on a Comcare session. I had a driver talking on that. And one of the powerful points the driver made, like his wife and him, they have this, and she checks in with him 3 to 4 times a day. And they have a few mates that check in with each other. And they showed I think it's the power of showing, look, you may be out on the road on your own, but what seems to be happening more and more is the camaraderie, the check-in, and just showing the power of just saying, I know we talk about Are You Okay Day, but I think a lot of these things are happening now that we're seeing, and like with your sort of program, we're going to hear about the impact in a moment. Yeah. Is it becoming a bit more normalised now?
Absolutely. And I think we've seen that with our 24/7 phone support line. So obviously that's available to transport logistic workers and their families. And it's often the support network, the partners or other family members who are calling in to get some advice about, how they can help their loved one. So that's definitely key. because often it's, those people who are busy behind the scenes doing, the administration work, making the appointments, encouraging and checking in. You're absolutely right. So that's why our program does have that extension component to it, because it's not just the truck driver in isolation, it's their entire support network.
And even then, Chris has just said, look, Channel 40 is so important. And we've got a little snippet from our toolbox talks, and there's a guy, just throw Cuz in there, and he just shows, he was just checking in exactly like this on a two-way, and he just pulled over at a BP station and said, look, I'll wait for you, mate. It shows you that, I know there's pressure on time and deliveries, but it shows that a lot of drivers are willing to take that step to help each other out and give that support as well.
Absolutely. And yeah, there's the key around the communication. Building up the trust in that transport community has been a big thing for us. And I know there's been truckies who've got on their radio channels to say, hey, those guys up the road, if you see them, actually stop and talk to them because they're not too bad. So that's also been really helpful in terms of spreading the word for us, that transport communication as well.
Makes it really authentic then if you've got other drivers advocating for you.
Absolutely, yeah, and I think that's definitely needed. The other factor that I'll say has been really useful for us is, some of the feedback that we get is they don't like these services that kind of come in and then come out. So services that go into a community and then leave. So it's been really important for us to have what I call repeated exposure at certain locations. And so then they see our signs and the very familiar kind of orange logo. If they don't have time the first time they see us to do a health check, it's, the second or third time that they're driving through that they'll be like, okay, you guys have hassled me long enough, or I'll do this health check now. But it's amazing because they've seen us potentially in New South Wales, and then if we're in Queensland at a distribution centre, they'll be like, oh, we just saw you guys down the road last month. So that's great too, that repeated exposure and building the trust with that community. That's definitely important for us.
And Emily, earlier you touched on, I guess, your 24/7 call out line as well. And we'll dive into that a little bit as well. But I was just wondering on that, have you found some peak periods when you get more calls coming in, or do they correlate to times of the year, or what do you guys see?
Yeah, we're definitely analysing the data around that to see, whether there's any kind of common themes or patterns, because it really has only been operational for about a year now. Definitely the late nights is common. So between that 11 p.m. to 2 a.m. mark, and also weekends. So basically when there aren't the support services available for them to call, that's generally when we'll receive the calls coming in. Yeah. So I think that's a really great offering, and it was really important for us to try and establish something that the truck drivers could relate to. We had received some feedback from truck drivers about some of the difficulties of calling 24/7 lines, and them not necessarily understanding the challenges of being remote or regional, or just the hours that they work. So we have partnered with Trauma Centre Australia, and we specifically partnered with them because they have that relatability and understanding of the challenges that the industry faces. So just in relation to that impact, and obviously with a huge amount of data now to be looking at kind of what's going on in this space, it's really important for us to use that to see like what kind of outcomes and what impact is the program actually having. So we have partnered with Monash University. They are completing an independent evaluation of health in gear. Not to lose people with the boring aspects of the research part of this, but it's called what we call a mixed methods study, is evaluating the impact. So that's basically looking at the data, the numbers, and then also the what I call the real life stories from truck drivers. So truck drivers who are participating in health in gear, have been speaking to Monash about, you know, the impact and what it's meant for them to be involved in this program. So it's really important for us to look at, is this program being effective in improving driver physical health and wellbeing? Are there any areas where we might be able to have greater influence? What could we refine to improve? And barriers about, you know, potential expansion.
And I would just quickly say on that, like anything, evaluation will help improve, because when we did the suicide and road transport prevention, there's so much material out there, but is it fit for purpose for the sector? Does it relate? Is it going to have the right sort of elements? And so I'd take my hat off to you in doing that, making sure it's getting evaluated as you go along.
Yeah, and I think it was also very important to us when choosing an academic partner to work with in this space, that they also understood the transport industry. So again, the reasons why we've partnered with Monash is also because of their connection and understanding of the transport industry through what was called the driving health study. So if people aren't aware of that, that was conducted over a 3-year period. And, you know, when talking to the people behind that project, I really felt like they understood, you know, the challenges and what, you know, some of the challenges of the data that they might see that's coming through. So they've been absolutely amazing for us to work with. Just in relation to that driving health study, they did what's called a financial forecasting model, which is on the screen, as you can see now. So they wanted to predict the impact on the industry and economy, and they used existing sources of data to look at, you know, what that prediction of cost might be. So they reviewed workers' compensation claims, life insurance death claims. And as you can see there, over a 10-year period, 2021 to 2030, there's an estimation of 6,067 lives being lost due to work-related diseases or injury in the truck driving industry alone. And then healthcare costs, including hospitalisations, medication costs, 485 million. And then in relation to the lost productivity costs, it's pretty significant, 2.6 billion. Now they're pretty sobering figures, and for people who know a truck driver or work in that industry, they would know that those figures that's real life. And, you know, I think the important thing for us to remember within that is they've shown that if we implemented a program just focused on reducing the health burden experienced by truck drivers by only 2%, the significant costing savings there kind of speaks for itself. So 10 million saved in healthcare and 53 million saved in lost productivity.
The big numbers.
Big numbers, yeah. So just back to kind of the timeline of what we're looking at in relation to our evaluation. It's quite a comprehensive evaluation because the program goes for a long period of time. We obviously had a rollout of 12 months. So we've received the interim report already. We received that towards the end of last year. And I'll be sharing some of those findings with you in the webinar today. Currently where we're at is Monash have received all of our final data for phase 2. So very excitingly, we're looking forward to getting that final report in July this year.
How exciting.
Very exciting. So just on the interim data that we've received. So as you can see there, we've had a total of 910 participants. And just to share some of the key demographics for you. So 29% were in that 18 to 34 years of age group. 18% were 55 and older. We had quite a large cohort being born overseas, so 45% being born overseas. And then 22% speaking a language other than English. We also had 1.5% identifying as Aboriginal or Torres Strait Islander. So quite a diverse group in terms of cultural diversity, as well as age diversity. Probably not surprising that the majority of our participants were male, 85% were male. However, you can see there with the orange graph that we had female representation as well. So with the largest being in that 18 to 34-year age group as well. And we're seeing a steady increase in the females who are working in the transport logistics industry. 70% of those were partnered and 72% had dependents. And I think that's important when we're talking about the social isolation factors or that support network, as well as the financial issues that transport logistics workers might face in terms of having dependents that they need to care for. That definitely places pressure on people to be meeting the needs of their families. Just in relation to a breakdown of the actual jobs that they were working. So as we said, we expanded into that logistics space as well. So 90% of people were employed full-time. And then the breakdown, as you can see there, we had 34% working in the warehouse and then 26% drivers, and then 25% who were office-based support. In relation to health concerns for participants, so compared to the general Australian population, of those 910 people that we saw last year, they had lower self-rated general health. They were more likely to be overweight, have a larger waist circumference. We had more smokers and a larger proportion exceeding lifetime risk of alcohol intake. So as part of that, part of our referral process is that if there are those risk factors showing when we're seeing someone for a health screen, is that we strongly encourage them to be referred to a GP. So we had 46% of men and 42% of women we recommended to go to a GP based on their waist circumference. And then we also had 4% referred to a GP due to high cholesterol and 6% due to high blood pressure. And while, again, they're not such great statistics, I think the important thing there is to recognise that we're picking up potential problems early before something chronic or acute occurs. So if we're picking that up while they're out on the road, refer them to a GP, that means they can be linked in to their healthcare provider as soon as possible, and work with their GP around addressing those issues before something terrible happens, like a heart attack or they do have type 2 diabetes. So that's been a really fantastic part of feedback from the program too, is the implications that's had for drivers in picking up those kind of health issues early on, which has meant that they've just had to make some general lifestyle changes rather than, for example, having to be completely off work for an extended period of time, due to a chronic health issue. Oh, sorry, Jerome, I can't hear you at the moment. I can see you talking. And now something's happened to your video as well. Tech isn't being your friend today. While you're trying to figure that out, I might just keep going. So I'll go to the what I call the qualitative feedback, so the feedback from truck drivers. So we had of those participants that were engaged in Health in Gear, We also had interviews that were conducted with them to talk about, you know, what they liked, what they didn't like, and the impacts for them about engaging with health and gear. Are you back, Jerome?
I'm back now. Should be
Yeah.
what happened.
Just before we move on, did you have anything that you wanted to say about that slide?
Sorry, I just moved something in here because I'm just sitting in a colleague's office. Couldn't have just moved that. Anyway, Chris here was just asking, were any of the other participants driving on site, such as mining, attending hubs, those sort of things at all? That was
not attending mine sites, but hubs, yes. Yes, definitely.
Excellent. Sorry about that.
No, that's okay. That's all right. So yes, back to this slide in terms of the qualitative feedback that we've received from truck drivers, and this is my favourite part of the interim results so far, because it's the real life stories straight from the mouth of truck drivers, which I think is just awesome. So they provided some feedback about our staff. As I mentioned before, Jerome, it's really important that we have a relatable crew that the transport community trusts as well. So you can see there some of the things that they thought were great was around our staff being open, friendly, approachable, that non-judgmental aspect to what we do as well. And the access component. We know that that's problematic, and part of that coming to their workplace, their time, their turf, outside of normal working hours too. So just want to chat about that for a bit. We don't work 9 till 5 when we're on the road. Sorry, just have some water. I've got a tickle in my throat.
I can imagine when you sat there and you mapped out and you showed the area of land that you guys covered off, like coordinating, getting everything together, it's a hell of a task.
Yes, absolutely. As I said before, very dedicated crew. They love what they do. But it does mean that they're away from their family for extended periods of time. And we do what's called a bit of a recon before we visit a site or a distribution centre to talk about, okay, when's the most heavy amount of traffic coming through? What's going to be the most benefit for us to maximise our time there, but also to actually see truck drivers. There's no point us just being there from 9 till 2 when they're kind of cruisy, pushy hours, and not seeing anyone. So we'll do very early morning shifts. I've done one of those graveyard shifts. I've got up at 3 a.m. in the morning, moon's still up. It's a strange feeling going to work when the moon's still up. And then we also work later evenings as well. And that's to try and get as many truck drivers as possible that are on different types of shifts, recognising, that they are not working your standard 9 to 5. And the content there was around that information was really useful and applicable to them. So again, providing resources or talking about things that aren't within their scope in terms of it's just not practical for them or it's not something that they can realistically do. We recognise that the content is just as important as our staff being friendly and approachable. Changes they made, so some really amazing changes coming through, some general themes there around changing their food or drink intake. So I spoke before, Jerome, about, reducing caffeine, or it might be reducing the amount of sugar, or, those mother cans, Red Bulls, that kind of stuff. Just reducing their portion sizes or just introduction of more fruits and vegetables. Physical activity increasing, returning to exercise, just generally doing more incidental stuff mainly. And also mental health or other health issues being addressed. So a lot of the people that we spoke to have said that they've started counselling or they've made those GP appointments and followed through with them. That's
great, Emily, and I think it's those small changes as well. Like I interviewed a truck driver the other day for one of our toolbox talks, and he said he was 150 kilograms. Now he got down to 90. He used to have like Macca's 3 times a day. And He said he's not a gym junkie, he's not this sort of stuff. His approach was he just varied his diet slightly. And then he just brought walking in. So his car would always be parked the furthest distance. He'd walk, he'd take the stairs, and he just created a whole habit and shifted his diet around and ate healthy. So like you're saying early on, it doesn't have to be these massive changes, but he just did it incremental. And he basically lost 60, 70 kilograms as a result.
That's amazing. Yeah. And it is definitely about making something that's sustainable. I think we've all tried those things that are, crash or fad diets, or gone through phases of like, yeah, I'm going to hit the gym 5 days a week. And after a while, you just burn out. It's not realistic. And so this program is all about those small, incremental, sustainable changes. The impact there, again, more energy. So just again, by making those simple changes, they felt more energetic, felt healthier, improved sleep. I think that's a huge one. Fatigue is such an issue in the transport sector. And some overall general health improvements, less headaches, lost weight, less pain. I just feel happy. I think that's really critical.
I like just that focus. It's more about me. So once again, it sort of brings it back to themselves, I guess, just reflecting on how they can have these little changes. And it does, all those bits flow through and life gets a bit easier.
Absolutely. Yeah. We want happy truck drivers, definitely. And here's some really nice quotes from truck drivers who participated in the program. I won't read them all out. You guys can read them on the screen there. But, the standout ones for me was around coming to us, working into our time in our schedule, making me feel confident about talking about my own mental health. I think that's really exceptional given some of the stigma around mental health and discussing those sorts of things. It's a really brave thing to talk to random strangers on the side of the road about your health and well-being. So the fact that they are feeling confident about talking about it is a really great outcome. So that nearly brings me to the end. I guess just in kind of closing remarks from me. Referring back to that slide that I showed you around investing in drivers' health and the savings that can have on our overall economy. I think we all have a responsibility to promote health and well-being of those working in the transport industry. And knowing the figures of the impact that a well-being can have, even if it's just improving slightly by 2%, then, my query is, what more can we be doing to support our transport community? How can we continue to expand the reach of a program like this? And how to ensure health and wellbeing initiatives are embedded in the transport community? I think, one of the things that I see is that this is a sector that's often forgotten. Unless things are starting to impact you in terms of, we saw this in COVID when things weren't on our shelves, we were all up in arms saying, why aren't we being supplied with the things that we need to be supplied with? So it's not until we actually experience the impact ourselves that we then question, well, what's going on? And I think the transport sector as a whole at the moment are really hurting. There's a lot of financial pressures as well as pressures on drivers. So, one of the things for me is about how do we work together collaboratively to increase the awareness of the impacts and connect more with people in the industry. We absolutely need to invest in our drivers because without them, there is no transport industry.
That's right.
Yeah.
Moving. Fantastic, Emily. Well, I've got a question here from Kim Hassel. Were there noticeable differences in findings between the drivers from around town versus long distance drivers?
Yeah, we've definitely looking into that. It's a really great question. So we actually added in a query around short haul versus long haul. And I think they both face there's similar challenges, but there's also unique challenges that each of them face. So the data from the final evaluation will definitely kind of speak to that a little bit more. But I guess just in speaking to those particular drivers, you know, just as a bit of an observation, is that, you know, the long haul drivers is a lot more around what I'd call workplace pressures, the time that they spend on the road. Whereas for short haul, a lot of it's about actually the other drivers on the road and the stress that it is, you know, if you're driving in a city and that people don't necessarily understand what you need to do when a truck's like beside you, how to safely overtake a truck, how to just safely drive next to a truck. So yes, definitely differences. And we're hoping that that final evaluation piece will kind of speak a bit more to that.
Awesome, Emily. Well, fantastic question here from Rod. Do they talk about the features of their vehicles that make a difference? I love that.
Well, that's actually a really great question. And no, I don't think we've gone into the features of the vehicle that makes a difference. We've definitely spoken about features of their workplace or elements of support that help them, but not specifically with the actual vehicle itself.
But I can share one thing with you, Rod. I was talking with another transport company about toolbox talks, and the driver came in. He just got shifted into a brand new top of the line for urban deliveries, and had all the bells and whistles. First time he just sat there. He's been driving 20, 30 years, and he just said, "Do you know how much better and more relaxed I feel during my day when the vehicle's helping me out?" Like he said it just takes the load off him. Like he's made aware it's helping him out the whole time, and it was just fantastic. He wasn't resistant to it by saying, "Wow, I should be able to do it this way," but he actively embraced it and he saw the benefits. So thanks.
I mean, I think if there's anything that can be done to make their lives easier, considering that is, you know, their occupation is getting into a truck and driving it, you know, if there are features that are going to help with that, then, you know, that's kind of a no-brainer for me. But I know that obviously there are challenges with that in terms of you know, the expense and the cost, and, you know, especially if you're an owner-operator, you know, that there are challenges in relation to having all of the bells and whistles.
Question from Anne-Marie. What channels do you use to communicate to drivers? And how do you reach them to make sure they're aware of your services? Good question.
Yeah, it's a really good question. So as I said before, we have our podcast, which is promoted through various channels. We have connections with other kind of truck radio stations that do that promotion for us. If we're going to be in a local community or specific area in relation to a hub, then we will ask for that particular location, that service station location, to be promoting for us so that people know in advance that we're going to be there. And we're also across kind of all of those social media channels, so people can follow us on, you know, Instagram, Facebook, and also our website, where we post information out about the locations that we're going to be at.
Thanks for that, Emily. And comment and question here from Billy. Loving this campaign. As we all know, truck drivers are all pressed for time. Are there plans to meet drivers in their own time as well as outside of the truck stops? As I can imagine, they just want downtime to relax and distress.
Yeah, absolutely. So I think that's part of the benefit of the 24/7 support line. So if you know that we're going to be in a location, but you're not going to be there, or you're going to miss us, then definitely, you know, reaching out to us via the 24/7 support line, so we can have a chat to you about, you know, where can we meet you or what is going to work for you. We're completely open to that. Yeah. And
another question for you that I've got, Emily. In your stats, you mentioned how 22.4% of the drivers were English as your second language, and then you had a large portion, nearly 50%, were born overseas. was wondering, how do you find sort of engaging, I guess, with English as a second language? Do you have people with a range of sort of languages as well, or how have you got about that?
Yeah, so I think we didn't really know what to expect when we launched the larger part of phase 2 last year. So gathering that information for us has actually been incredibly helpful to know what are some of the common languages other than English that are being spoken within this community. And based on that data, we'll be then translating some of our resources into some of those languages. And I think the key part to us is also about the accessibility component. So it's not just about the languages spoken, but also about potential low literacy levels. You know, some truck drivers just can't read as well. So it's around making sure that they can still access that information. We have little voice clips inserted into our health tips as well. So if they want to just listen to that, that's also an option too.
Love that angle of inclusivity. That's fantastic to hear that sort of steps, I think. And that's a way of probably making the industry more attractive to draw some of these more new people in as they come to the country as well. Absolutely. Yeah, I think the people that we've seen is just so diverse. And we definitely want to make sure that it's accessible to all truck drivers. And, you know, that is challenging given that we are quite a small organisation, but, you know, we're definitely banking on that relatability aspect of what we do. And also that it's about, you know, the simple communication of information and that support based on what their needs are. Yeah, I love that. I think a lot of people underestimate, I should say, just how important getting the comms right. Like, people just don't want this massive plethora of material. It's how do I make it resonate? How do I talk in their languages? And especially if you're time poor. Absolutely. Yeah, we're all about boots on the ground and just getting to know someone, like asking the question, what would be helpful for you? You know, if you don't like our health tips, that's cool. What would work? Yeah. Well, that's fantastic, Emily. I think just in our last thing as we sort of close up now, I'll just throw it to you. If you just wanted to share one key take-home point, one learning, one thing that's really spun out to you and just gone, oh my God, that's amazing, or insight, what would that be? I think it's when we hear those stories about the impact it can have on someone's life. So we've had some kind of incredible stories come through where truck drivers have said, you know, it's kind of completely turned their life around. There was one person who went to a doctor based on our recommendations and was basically, you know, potentially about to just have a heart attack, and went in and had surgery, and it saved his life. So that's one truck driver. And for me, if that's the impact we're having on one truck driver, that's enough for me. That's, you know, we've had a huge impact on that person's life. They're still here, they're healthy, you know, their family's very grateful. So that's what makes me get out of bed every morning and, you know, do what I do. And I know that the team feel the same too, in terms of if we have an impact on one person, that's amazing. Wow, Emily, I must admit, you do know how to close out a webinar. What is Thanks, Jerome. That was awesome. You never know where people are going to go with that. I think that is just absolutely spectacular take-home message to leave. So thank you absolutely so much for your time today and just sharing the amazing work. And when the evaluation comes in, really keen to help promote and put it out there. Look, and Graham's just stuck in with one last one. Is there any plan on running this program at key project sites where there are a large number of drivers? So Graham just snuck in at the end here. Thoughts? Yes, absolutely. We're always keen to hear, especially from people in the transport community, where those locations might be. You guys know where they are, you know where these people are, where we're going to get the most audience. So we're always obtaining information from the community about places where, you know, there's you know, going to be a large number of truck drivers at any one time. So we're always happy to hear from people about that too. So please reach out to us, you know, via our social media or our phones, and provide us with that information so that we can see whether we can be there to support. And Billy's just stuck another one in, of course. Is there somewhere we can see where your team will be at any time? Website, Twitter, etc. And
yes, so you can go into our website, which is healthygear.com.au.
And we'll include that because there'll be a follow-up email that will go out to everyone following the webinar. So we'll include that. There'll be a link to the PowerPoint on our website and, of course, to the webinar. So we'll include Emily's details in there, so you can certainly reach out to her, because I think any one of these opportunities, if you can add another few truck drivers' lives being saved, if not a plethora of them,
Absolutely.
I think it's a fantastic job, Emily.
Fantastic. Thank you so much, Jerome. Thanks everyone for joining.
My pleasure, and thank you everyone for joining us. And we'll have another webinar next month, looking around road workers and our campaign that's going out next week. It's for the National Road Safety Week, and then another one with Mitchell Services, and we've got a couple others, SA Power, and a few other ones later on in the year that we're putting together as well. So thank you all very much for your time, your great questions, and of course to Emily, our amazing presenter from OzHelp with the Health and Gear. Have a wonderful day.
Bye everyone.
Bye.